Alzheimer's disease. Alzheimer's disease is the leading cause of dementia, a group of conditions that all gradually destroy brain cells and lead to progressive decline in mental function. Alzheimer's disease accounts for 60% to 80% of dementia cases, and it is the fifth leading cause of death in the United States among people aged 65 and older. People with Alzheimer's experience memory loss, difficulties communicating, learning, thinking, and reasoning problems. They're severe enough to have an impact on an individual's work, social activities, and family life. As the disease progresses, individuals may also experience changes in personality and behavior, such as anxiety, suspiciousness, or agitation, as well as delusions or hallucinations. Risk factors include age is the greatest known risk factor, people age 65 and older. Family history. Having a parent or sibling with Alzheimer's diagnosis can increase your risk. Genetics. There are two types of genes associated with Alzheimer's disease. Risk gene, which will increase your risk for developing Alzheimer's disease. Deterministic gene, which will guarantee that you will have Alzheimer's disease. There is a very low percent of people with the deterministic gene. Lifestyle. Lifestyle choices can also impact your risk. Having poor or unhealthy diet, eating foods that are high in sugar, fat, or cholesterol. Examples of these foods would be processed or ultra-processed food, fried foods like French fries or chips, high sugar foods like candy, sodas, and other packaged items. Having a sedentary lifestyle and having a lack of daily physical activity. Each of these examples can increase your risk. Progression. Symptoms worsen over time for everyone. However, people progress through stages of Alzheimer's at different rates as their abilities change. On average, a person with Alzheimer's lives 4 to 8 years after diagnosis, but can live as long as 20 years, depending on other factors. The areas of the brain that control memory and thinking skills are affected first. But as the disease progresses, cells die in other regions of the brain. Here's a slide to represent the Alzheimer's continuum. On this continuum, there are 3 broad phases, shown on the slide in teal, orange, and purple. The first phase is called asymptomatic. In this phase, there may be changes in the brain long before a person begins to have symptoms or gets a diagnosis. Mild cognitive impairment, or MCI. As the disease progresses, the person will begin to experience mild symptoms, but will still be able to independently perform most activities of everyday living, working, driving, and other daily activities. The person or their friends and family may start to notice small changes, with the person becoming more forgetful or confused. MCI can develop for multiple reasons, and individuals living with MCI may develop dementia due to Alzheimer's. Others may have MCI due to other medical conditions, like high blood pressure, thyroid, or blood sugar, and so on. That is why it is important to see your doctor. In the third phase, people who do develop dementia due to Alzheimer's will experience more serious changes in memory, thinking, and behavior. This phase is further broken down into stages called mild, moderate, and severe. These stages reflect the degree to which symptoms interfere with the person's everyday activities. It's important to understand that the stages of Alzheimer's are general, and because each person living with the disease has a unique experience, we can't always neatly place an individual into one specific stage. In fact, some people may exhibit symptoms that overlap stages. The stages do allow you to gain a general understanding of the progression of the disease. As Alzheimer's progresses, the individual's behavior will change, as does the role of the caregiver. These stages can help caregivers prepare for what to expect and understand how to best respond.